Just 2 years ago, the American Heart Association put out an article stating contaminant metals as cardiovascular risk factors, a scientific statement from the American Heart Association. What they're saying is that not everybody that has a heart attack has insulin resistance, nor do they have high LDL. These are what the regular cardiologists talk about, especially LDL. And then the functional doctors, they talk about insulin resistance. But hardly anybody ever talks about toxicity being a major severe risk factor for having heart disease. And another thing that doctors don't talk about is infections causing heart disease. And it's known that the more infections somebody has, the greater the chance they're going to have a heart attack. And what do infections lead to? They lead to inflammation. So infections, inflammation, toxicity, those are major factors for heart attack. And guess what? They're all measured with that blood test called MVX Plus. I've been talking about that for quite a while. So as I listen to podcasts and I listen to cardiologists talk about heart disease and plaquing, I want them to talk about the other causes, because I personally had an infection. I had mold in 2016. I went to get an EKG 4 times that year. Like, it was all heart symptoms. And in 2024, I had a gas leak. That's toxicity. And I went to the ER with crushing chest pain and high blood pressure. So in my case, I had infections and toxicity causing heart disease. And they only asked me about what's your LDL. And like, they tested my blood for that. And they look for plaquing in the arteries. And that's all they look for. They didn't ask about any other causes of heart disease: infections, inflammation, toxicity. So I'm just saying that cardiology needs to do better and look at the other causes of heart failure and heart disease. It's not just LDL or insulin resistance.